miscover. Okay, this is, again, another point. I just love this diagram. Thank God Dr. Hersky wrote this. This is beautiful, or devised this. In my experience, people in phases 3 and 4, therapy doesn't even touch the surface. Phases 1 and 2, yes. Phases 3 and 4, I've had a lot of people in phases 3 and 4, like stramonium, burritocarb, helleborus, arnica, hyoscyamus. Therapy is just like, it's good. I'm not saying it's not useful. But they have to have the right constitutional remedy in them. So just remember, if you get a patient that's helleborus, you can talk all you want. They want to, they feel horrible. Like if a person is aurum and they want to kill themselves, therapy is just not enough. You need to put aurum in them. So just remember this map of hierarchy. It's very useful. But if a person is, say, phosphorus and they have anxiety, maybe therapy can be helpful. I'm going to finish up. It's 11 already, isn't it? 11:03. Can I just go over 5 minutes? Can you stay with me? Okay, so homeopathic counselor. We are like counselors in a way, although we're not licensed, I guess, counselors. We don't have the experience. But our listening skills as homeopath, I think, is healing. A lot of our patients love us. I sometimes refer my patients to therapists. They're like, no, you are my therapist. I'm like, I don't have the skills to be a therapist. But they're like, well, you are. You listen to me. You hear my story. I can unravel my deepest secrets. They just love to talk about their secrets to us. And that alone must be obviously very healing. And then the client self-monitoring and self-reflection that's embedded throughout the conversation, their path, is very healing. People think about their life when they talk to us. They reflect. That alone is healing. So we're kind of like counselors. In fact, there are doctors, they say that we should actually have this certificate called homeopathic counselor. I think that's a cool idea. Dr. Young talks about how just talking about the conscious mind is not sufficient to heal a person's mind. You need to touch the unconscious. And Jungian dream analysis, I think, would be a great idea for homeopath. Psychiatrists don't like to refer to us as a rule because they're afraid we're going to stop the medication. They're afraid of that. I've talked to a couple of them. So please, if you work with this person who is a psychiatrist, maybe get on the phone, talk to a psychiatrist. Tell them, I promise you I'm not going to do that. And please, you promise me, don't tell the patient, don't start a new medication right when I give a remedy. So there has to be a mutual understanding. There's got to be one change at a time. Give the remedy, no changes in the drug. You start a new drug, no changes in the remedy. That's very, very important. I've been hurt. My patients have been hurt by that. Like sometimes they start two things at the same time. We don't know what's going on. And yes, you can use both. If you're feeling here with SSRIs, you can be feeling even higher with the remedy on top of it. So you can do both at the same time. There's no problem doing that. Let's see. What else do I want to say? These are some tips on how to wean people off of the drugs. Again, refer to psychiatrists to do that. Try not to be the sole person. It's too much responsibility for you. Look out for provings. You don't want to prove. Don't give the wrong remedy too much. I never give a full bottle of a remedy to a patient because they're always the OD. You give a full remedy, full bottle, they take the remedy every time they feel bad. So you certainly don't want to give a bottle of stramonium to a person or helleborus. It's like, please don't do that. It's terrible practice. Naturopaths do it who don't know much about homeopathy. I advise completely against the practice. Just give them one remedy at a time. You should dispense it. And Shola, do you want to come up here for a second? So this is something that I think is cool for you guys to look at, to maybe, here, there is an art in administering the remedies. So Shola is my daughter here, and I just want to tell you how I dispense the remedies. For one, I make sure the person is hydrated, so I make sure they have 3 cups of water first, like right before I do anything. As soon as they come in, I'm like, please have some water. Then I make sure they're well fed. If they're not, I might still give them the remedy. But if they're dehydrated, I won't, because I've seen the remedy not work. Water carries the remedy. The vibration of water, the water has to be in the water so the vibrational medicine can work. So I have them drink water, and then I start doing the tapping thing, EFT, and I don't do the whole EFT. I just touch the top of the head, and of course people think it's weird, but I really don't care if they label me. I tell them, is it okay if I do a little acupressure on you? They're like, sure, nobody minds. And then I do the forehead, the third eye. So a lot of times I get like this, touch the forehead and the top of the head, just like that, and I might just move my hand like this in small circles. I don't tap it, because that's irritating, just like this. And hopefully those of you who are more sensitive can appreciate something like that. I keep my finger right there. It is the most relaxing point in the body, the third eye. People just want to fall asleep. The longer you hold your finger there, the more relaxed the person gets. I've seen it over and over again. And if you have good intention, it goes a long way. So then, a lot of people I've seen, they love being held. They love their head being held. So I hold their head just like this. And of course, I get them to the side so they don't feel invaded. I go like this, and just hold the head. I might just go like this, just hold the head. I might tap their chest and say, take a deep breath. and then do this again, just like this. Just like this. And if they were my daughter, I'd kiss them too, but I don't usually. Thank you. I'm good, honey. So, thank you, honey. So that's how I administer the remedies. It works so much better. So there's this little thing I've come up with. I'm embarrassed to label anything after my name, but I didn't know what to call it. So I call it Dr. Sharif's double dosing idea. What that means is if I give the remedy and I'm looking at them, I look at them. I'm like, let me see if I see an energetic shift. Dr. Zeff talks about that. I have definitely seen it hundreds of times. If the remedy is right and you do the thing that I just talked about, water and tap and all that, and the person's energy doesn't shift in 10, 15 minutes, either you're not able to detect the shift, which might happen if you're not energetically inclined, which hopefully if you do homeopathy, you are. If you don't see the shift, you should do more tapping. Say, I need to do more acupressure on you. Do more acupressure, tap, have them talk about what's bothering them. Get it out of them. And then when they release all that and have your ears for 10 minutes, and you tap them some more, after 15 minutes, you can give them the remedy again. It seems like it really goes, and then I see the energetic shift happen right in the office. It is phenomenal how effective this technique is. This is probably the niftiest thing I could share with you today, next to dehydration before administering the remedy. Hydration. Things that antidote the remedies are listed. Coffee does antidote, for those of you who are wondering. It definitely antidotes 99% at least 90% of the cases, any kind of coffee. 80-90% of my patients get better by at least 70%. So if you do good homeopathy, you can have that kind of success rate too. This is just some basic stuff: empathy, sympathy, intention, caring. We don't want to just have mental health care. We want to treat our patients. We don't want to treat our patients. We want to care for our patients. And we do care for our patients. So make that known. Let your patient know that you care. Give them, just telling them the idea that tomorrow is better. Hope goes a long way. So these are things you can actually impart to your patients. Don't just say, here's a remedy. You are more powerful than the remedy. Really, you are. You're ultimately more powerful. I've heard great homeopaths on the planet can just, this might sound a little voodoo to some of you, but can send a vibrational energy to a patient. I know that sounds funny, but it's a thought. Your energy can heal the person. It's not just a remedy. So energy medicine is definitely on the rise. There's a new paradigm that you can see it happening everywhere. There's all these different energy modalities. Homeopathy is definitely, in my opinion, energy medicine. The remedies start the self-healing process. And the remedies help the patients go beyond feeling okay, and they provide deep psychological transformation. They can help people feel self-actualized. We're not just talking about antidepressants. We're talking about self-actualization. We're talking about feeling deeply joyous. Hahnemann speaks about the higher purpose of our existence. Homeopaths are into this kind of talk. And in conclusion, homeopathy has focused on the mental health care of its patients for more than 200 years. The importance it places on the mental and emotional symptoms in every disease, whether it's physical or emotional, the high patient satisfaction, safety, and the low cost, they make homeopathy a strong candidate for inclusion in global mental health care policies. We really do need an alternative. So let us come together to reduce the mental and emotional suffering of our fellow human beings. I want to end my talk by this New Zealand expression. I don't know how to say it, but it's Tangata Motuhaki or something. It basically, they mean that they use this expression for people who celebrate their own uniqueness. And obviously, we're all unique. So I really believe we should learn to celebrate rather than despise your own uniqueness. And so if you have patients that are suffering from psychiatric problems, encourage them, tell them this is nothing to be embarrassed by. Encourage them to develop self-acceptance. You accept them. You may be the only person that accepts them. And you need one person in the world to make your life different. Here's my contact information. I'm available outside the hall for the next 15, 20 minutes if you want me to try to identify your remedy, like your simillimum, on the spot. If I can't do it in 5 seconds, that means I need to take your case. I don't have time for it. But if you want to just see, if I can tell in 5 seconds what your remedy is, and my daughter can do that too, we'll be right outside the hall, right there for 15, 20 minutes. Afterwards, we're going to go, was it 1 o'clock? At 1 o'clock, we'll be by the bookstore between 1 and 1:30. There's a few books left of mine, the visual homeopathy book. I'll do a little bit of book signing. There's only 5 left, I think. But I'll be there just mainly to answer questions between 1 and 1:30. And if you want to email me, I'm available. My email's right there. You can call if you're stuck with some. If I can help, I'd be honored to help. These are the books I use. It's 13, 14 books. And here's my contact information. So thank you so very much for your attendance. Thank you. Thank you. So I'll be right outside.